Okay, everyone, thanks for attending the Unhealthy Food Advertising Targeted to Hispanic and Black Youth webinar hosted by the UConn Rudd Center for Food Policy and Obesity, Council on Black Health, and Salute America. A new report released earlier this year highlights increasing disparities in unhealthy food advertising targeted to Black and Hispanic youth. Today we're going to hear from the report's authors to see how food and beverage companies continue to advertise their least healthy products, including candy, fast food, sugary drinks, and snacks, to youth in communities of color, and learn what can be done to encourage food and beverage manufacturers, restaurants, grocery retailers, and media companies to improve their targeted marketing practices. Jennifer, you can advance the slide. My name is Sally Mancini, and I am the Director of Advocacy Resources at the UConn Rudd Center. I'm going to start us out today with an overview of what we'll cover on today's call. After I share a few instructions with you and introduce our speakers, we'll head into the main presentation. At the conclusion of the presentation, we'll have time for questions, and I invite you to share questions in the chat box on the right-hand side of your screen. Our hope is to get to as many questions as possible on today's call. Right now, all participants are in listen-only mode, and if you have any technical difficulties during the call, please add them to the chat box or text or call 860-209-0122, and we'll do our best to fix them. Lastly, we'll be recording today's presentation for posting on our website. Next slide. Now I'd like to introduce today's speakers. So first off, we have Dr. Jennifer Harris. She's the Director of Marketing Initiatives at the UConn Rudd Center and Associate Professor in Allied Health Sciences at University of Connecticut. At the Rudd Center, Dr. Harris leads a multidisciplinary team of researchers who study food marketing to children, adolescents, and parents, and how it impacts their diets and health. Her current research focuses on targeted marketing and health disparities affecting Black and Hispanic youth, new forms of marketing targeted to youth on social media and mobile devices, and effects of food marketing on what and how parents feed their babies and young children. Second, we have Dr. Shariki Kumanika. She is a research professor at Community Health and Prevention at the Dornsife School of Public Health at Drexel University, and Emeritus Professor of Epidemiology at the University of Pennsylvania. She is founder and chair of the Council on Black Health, formerly known as the African American Collaborative Obesity Research Network, or ACORN. Dr. Kumanika's research focuses on identifying effective strategies to reduce nutrition-related chronic disease risks, with a particular focus on achieving health equity for Black Americans. For more than 30 years, she has led or collaborated on single or multi-center randomized clinical trials or observational studies related to obesity, sodium intake, and other aspects of diet and lifestyle. She is a member of the National Academy of Medicine and is a past president of the American Public Health Association. And lastly, we have Dr. Amelie Ramirez. She's professor and interim chair of epidemiology and biostatistics and director of the Institute for Health Promotion Research at UT Health San Antonio. Dr. Ramirez is an internationally recognized health disparities researcher. She currently directs the Salute America National Multimedia Program to empower its vast network of 250,000 community leaders to drive health policy and system changes to promote health equity and support for Latino families. She has 30 years of experience conducting behavioral and communications projects to reduce cancer, increase screening rates, and clinical trial participation. And we're excited to have all three presenters be with us today for our targeted marketing presentation. So now I'll turn it over to Jennifer.
Thanks, Sally. So I'm going to give a quick overview of the report, but this is just more of a teaser. The full report is available on our website, so hopefully you'll want to take a closer look afterwards. But let me start by just defining what we mean by targeted marketing, which we define it as marketing that's designed to appeal specifically to a group of consumers that the company has identified as a business opportunity. So this could mean marketing in specific targeted media like Spanish language or BET, Black targeted television. It could be marketing in another language like Spanish. It could be marketing that features celebrities and other actors of color, or even special flavors that are designed to appeal to a specific audience. So targeted marketing is not necessarily a bad thing. In fact, it can be a great thing for business especially, and also for consumers, because the value of targeted marketing is that it recognizes the importance of this audience as a consumer for the company. And when we talk about Black and Hispanic consumers, these are groups that have been previously ignored or even discriminated against by companies. So in that sense, targeted marketing is a positive. It also creates profits for shareholders. Communities of color are important consumers, and if you appeal to them, it can be very good for your business. It can also be good by offering culturally relevant products and messages that just demonstrate that the companies value these consumers. And in the case of children, what companies say is that they found that multicultural messages have a lot of appeal to all youth. So Black and Hispanic cultural themes in particular make their products seem cool and appeal to youth, to all youth. But the problem with the targeted marketing in the food industry is that almost all of the marketing that's targeted to Black and Hispanic youth is the worst product. So we did a report in 2013 that showed that fast food, sugary drinks, candy, and snacks were almost exclusively the only products that were targeted to Black and Hispanic youth. We also showed that Black children and teens saw a lot more ads for these categories than other youth saw. And because of that, we concluded that the targeted marketing we were seeing exacerbates health disparities that affects communities of color. But since 2013, the industry has made improvements and pledges to improve their products. In particular, the Children's Food and Beverage Advertising Initiative has created more strict nutrition standards for foods that can be advertised to children in child-directed media. And many or most of the largest food companies have announced corporate initiatives that promote nutrition or health and wellness. And just a few examples I have on the screen. But when we looked at these commitments, what we found is that none of the companies said anything about targeted marketing to communities of color or low-income consumers. They just weren't mentioned in their promises. And so what we wanted to find out was if these promises have actually resulted in improvements in targeted marketing to Black and Latino communities. We don't have access to companies' proprietary strategy documents, so we can't say for sure that this is targeted marketing or not, but there's a number of indicators that we use to identify whether companies are targeting marketing of some of their products to Black and Hispanic consumers. So one thing I should say is that we looked at the 32 largest companies. We didn't look at every single company. There's about 10,000 food companies that advertise. So we picked the largest ones. And we use Nielsen data, which is the source of data that companies use to evaluate their own advertising plans. So we feel it's especially relevant for that, for this analysis. And what we used to identify targeted marketing was first what companies were spending on advertising on targeted networks. So Black targeted TV are networks where more than 50% of the audience is Black consumers, and And then Spanish language TV is clearly targeted to Hispanic consumers. We also looked at youth exposure to advertising, and we are a little bit limited by the Nielsen data, but we can look at how many ads Black youth see and compare that to the number of ads that white youth see. And if the targeted ratio is higher than average, we conclude that they're probably placing their advertising on television programming that Black youth are more likely to watch. And then we also have numbers for ads viewed on Spanish language TV by Hispanic children. And then the last thing we did was look at the company statements, things like their annual reports and press releases, to see what they were saying publicly about their targeted marketing. And we did our analysis at 3 different levels. We looked at what companies were doing overall. And as I mentioned, we looked at the 32 largest restaurant, food, and beverage companies. These companies represent 3/4 of all food advertising, so it's the vast majority of ads. And that was our definition was that they spent over $100 million in advertising, or they participated in the Children's Food and Beverage Advertising Initiative. And then within those companies, we looked at the most highly advertised brands that they promoted, and then we rolled the brand level data up into product category level. So I'm going to talk to you about our findings at each of those levels. The first is those 32 companies spent $9 billion in total advertising in 2017, and almost all of that, 85% or almost $8 billion, was spent on TV advertising. And then when we break out of that TV advertising, how much was spent on Spanish language versus Black targeted TV, you see overall these companies were investing about 11% of their TV advertising budgets into targeted media. And then we found some interesting things when we looked at these numbers compared to 2014. So overall, TV advertising spending was declining by 4%. Spanish language TV advertising declined by 8%, but advertising on Black targeted TV went up more than 50% during this time. And then when we looked at the specific companies and where and who was investing the most in targeted media, we looked at it a couple different ways. We first looked at the total amount that companies are spending on targeted advertising. So this chart is Spanish language TV. And then we also looked at the percentage of their advertising budgets that were spent on targeted media, because a company like McDonald's is going to spend a lot of money on all media because they just have the biggest marketing budgets, but it also is important to see what proportion of their total budgets were spent on targeted advertising. So here in the top right quadrant are the companies that are spending a lot of money on Spanish language TV and also investing a high proportion of their budgets to Spanish language. And again, and you see Mars and Nestle are way at the top here. And then in contrast, these companies down at the lower left-hand quadrant are spending nothing on Spanish language TV, or low amounts, and then also a low percentage of their budgets. We did the same thing, looked at the same thing for Black targeted TV, and here you see the companies fall out a little bit differently, but again, these companies up here, Hershey and PepsiCo, stand out for spending the highest amount of money on Black targeted TV and also the highest proportions of their budgets. And similar companies are down here in the lower left-hand quadrant. We also looked at changes in how much money companies were spending in the different, in Spanish language and Black targeted TV. So of the top 5 companies here, you could see Subway, Coca-Cola, Nestle, McDonald's, and Mars represented about a third of all advertising spending on Spanish language TV, or all food advertising spending. And there were some big increases from 2013 to 2017. For example, Nestle and Coca-Cola more than doubled their advertising spending on Spanish language TV during that time frame, versus there was one company, McDonald's, declined by 23%. In Black targeted TV, the top 5 companies were Roar Capital Group, so that their main brands are Arby's and Wingstop, Domino's, Hershey's, Yum Brands, and PepsiCo. And here you can see this overall increase in targeting on in spending on Black targeted TV. And most of the companies increased their spending in this medium. The only decline was Hershey, which went down by about 9%. Then we looked within the companies which were the brands that were targeting different audiences, because a company typically will aim their different brands at different consumers. So about a third of all the highly advertised brands that we looked at were targeting Hispanic consumers. These brands spent the most money in Spanish language TV, so you see a lot of fast food and also Coca-Cola Classic. So this is the regular Coca-Cola, was the third largest spender on Spanish language TV in 2017. And then when we look at the percentages, you'll see some brands spent a very high proportion of their TV advertising budgets on Spanish language TV. And just as a reminder, in comparison, the median for companies was 8%. So, you know, when Big G cereals or Pop-Tarts spends more than 40% of their total TV advertising on Spanish language TV, it's pretty clear that that's an important consumer for them. We did the same thing looking at brands that were targeting Black youth, and here more than 50% of these highly advertised brands appeared to be targeting Black consumers. The top spenders were all fast food brands, and then their share of budget, or the ones with the brands with the highest share of budget, were a little bit more varied, and this compares to, on average, 2.5% of companies' total budgets were spent on Black targeted TV. So, you know, these brands are all highly targeted to Black consumers. When we rolled the brands up into categories, across the board, we found that about half of all food advertising spending was promoting fast food and other restaurants, and this was across the board in all TV, in other TV, Black targeted, and Spanish language TV. But there were a few other categories that are disproportionately spending their budgets on Black and Spanish language TV, which is candy, sugary drinks, and snacks. So these are the 4 categories we found in the first report, and pretty identical to what we found here. So these categories are spending more than a third of their, or represent more than a third of the spending on Spanish language TV, and versus 27% on other types of TV. Looking at the healthier categories, we combined nuts, juice, plain water, and fruit, and those categories combined represented less than 1% of advertising spending on Black targeted TV and Spanish language TV. And just to be clear, these brands aren't advertising much on any TV. They represented 3% of total TV advertising spending. So even though they're not advertising on Black or Spanish language TV, they're really not advertising much at all anywhere. So the last thing we looked at was how many ads youth were seeing for the categories that we looked at, and these are the numbers of ads viewed by Hispanic children and teens on Spanish language TV. So on Spanish language TV, fast food, candy, sugary drinks, and snacks were represented 80% of the ads they viewed. This is annual ads, so it amounts to almost 2 ads per day for children and 1.3 for teens, but this is only the advertising that they're seeing on Spanish language television. So Hispanic kids also watch a lot of advertising on other types of television programming, but unfortunately we don't have the data from Nielsen to be able to show what those numbers look like. For Black youth, however, we can compare the number of ads that they're seeing on all types of television and look at also what white children are seeing. So just to explain this slide a little bit, overall, Black children and teens see about twice as many ads, food ads, across the board as white children and teens see. But these numbers aren't the same for all categories. So if you look at the categories like the candy and gums and sugary drinks and restaurants, the numbers are the difference is higher than if we're looking at all other types of categories. So again, those categories that I keep talking about are the ones that Black children and teens are seeing much more than white teens are seeing. So conclusions of these findings, as I said when I started, targeted marketing isn't necessarily a problem, but the current practices that we're seeing are including the high levels of junk food advertising, the fact that companies are even less likely to target healthier products to Black and Hispanic consumers, and the disproportionate increases in targeted marketing by some of the companies and the product categories that we found. So Shariki and Amelie will also be talking about recommendations, but in the report, what we called for, first of all, is an improvement in food marketing to all children and teens. Anything that's done to improve the quality of the products that are advertised to children and teens will also benefit Black and Hispanic children as well. And recommendations like expanding the CFDAI to include advertising to at least 14-year-olds and things like sugary drink taxes will also improve food marketing to all youth. The companies, when they're making industry commitments to market healthier products, they should also make commitments to improving what they're marketing to Black and Hispanic consumers, and the media that are accepting these advertising could also take action and establish nutrition standards for advertising that they will accept. And this isn't without precedent. Disney does set standards for products that can be advertised on its networks. And then I just want to end with a few quotes from focus groups that we did with Black and Hispanic teens in Hartford. This paper is actually coming out in the next month or so, but we wanted to find out, you know, they're seeing all these ads, what do they think of it? And I think what they said is really inspiring and gives me hope that things can that they will take action at the grassroots level. So kids said things like, I feel taken advantage of, I'm not going to go to Wendy's as much, and they're blanket exploiting the fact that we don't have the resources to go and buy things that taste good and are healthy. We have to limit ourselves to their food. So this is what 16 and 17-year-olds have to say about the targeted marketing that they're seeing. So thank you, and I'm going to hand it over now to Amelie.
Well, thank you very much, Jennifer. This is a truly amazing report that you and your team there at the Red Center have put together. So I just wanted to highlight a few things that you've identified in your report that, you know, that we've had over, $500 million that is being spent on marketing to Latino kids on Spanish language television. And we see that these companies are still spending large amounts of their marketing dollars, you know, to reach the Latino population at a fairly young age. And we feel that these companies know that our population is young and is growing, have now become, you know, the largest minority population, and they have not in the past spent a lot of efforts in targeting them, but they are now. And also that, you know, that the marketing is starting at such a younger age. And what we see is that these companies are working hard to kind of build that brand loyalty, and that is something that Latinos and Hispanic families and children are noted for, that, you know, they really kind of stick with the brand once they start with it. So this is something definitely that companies are making note of. And I guess I feel what's of greater concern is the amount of ads that they're seeing on Spanish language television. And then it would be interesting to get future data in terms of English language, because our children are growing up bilingual. They're being exposed to both. And so I'm wondering, you know, truly how high some of those rates are. So we need to do more, study with regards to that. And even though only 1% of the millions of dollars being spent on marketing are targeting Latino kids for healthier food products, you know, why isn't the healthier food product industry more interested in promoting better foods in our communities? And I'm sure Ricky will have some thoughts on that as well, right? There's again, this is a new market by marketing healthier things versus getting them, you know, to buy the unhealthy foods, that we really need to work on that. I'd love them to see them market more things such as water, fruits, you know, nuts, items that they can still make some money off of, but that are obviously much healthier for our kids. On the next slide, we feel that we really need to address policy solutions, and I think, Jennifer, as you've identified, we need to be more active in trying to get the Children's Food and Beverage Advertising Initiative to raise their age from 12 to 14 years of age, and I think concerted efforts to do this will be necessary. So how can we all work together to make that happen is something that maybe we need to get our heads around. Another item is that it's important, but we should also consider that what can be done to limit the targeted marketing of junk food on Spanish language television. So in addition to going, trying to work with the children's food and beverage advertising, overall, what can we do with the general marketing industry so that, to ensure that our children are growing up in healthier environments? We need to do more there. This is where, if more states and communities got involved in encouraging soda and junk food taxes, and that the monies raised from these initiatives could go towards developing more public health initiatives to help bring more positive solutions to their communities, as obesity continues to be a major problem for our young children, as young as 2 years of age. So we need to definitely start early. We must also see a demand for healthier food access in our underserved communities. We all know that the billboard advertising for many of the companies that you've identified, really are scattered throughout our communities as our children pass by or walk by from going home from school, are constantly being bombarded by this junk food advertising. So in terms of what can we do to address some of these issues, I really feel that we need to do more at the grassroots level, encouraging our community, making them realize what's happening, encouraging more media advocacy and social media and coalitions that can come together to put pressure on the marketing industry. But we also know how difficult it is because so many of our larger advocacy organizations get money from some of these same companies. So instead of saying don't market in our communities, maybe we can say if you're going to market, please market your healthier foods. We need to take a different type of approach with Coca-Cola. So market your water versus your sweet and sugared beverages. And ultimately, we just need more grassroots action at every level, both from the bottom up and top down to make these things be able to happen, and working more closely with some of our larger organizations so that we can all be pushing one message in order to create that change. And then lastly, on the last slide, I think we can do more to get involved in this targeted marketing, and we'd like to kind of share one of our examples of some of the work that we're doing at Salud Americas, where we're identifying community heroes that are taking action for healthier marketing practices and access to healthier foods in Latino neighborhoods. And this is just an example of one of our Salud heroes, Evelyn Brito. She is from Lynn, Massachusetts, and she noticed that, there was just a tremendous amount of junk food in the corner stores of the bodegas in her community. So she actually launched a fundraising campaign to help bring healthier foods to corner stores, and actually filmed a series of corner store makeovers, and showing what, getting your community involved and the action that they can take at a local level. So we were really excited to learn about her work. And our Salud America website, features some great examples of some of our heroes like Evelyn and some of the solutions that are being implemented at the community level. So I hope those that are with us today will take time to look at our website and participate with us in some of our social media activities to help, develop a healthier community for our Latino community. And we just encourage everyone to get more involved and to begin more actively asking our marketing industry, how can they be more responsible to our communities? So again, I thank you, Jennifer, your team, and the Red Center for pulling this very important report together.
Thanks, Emily. So I'm going to hand it over to Shariki now.
Thanks, Jennifer. So I want to build on some of the points that Emily has made and on the sort of stark reality that these findings present. There are lots of different types of concerns that are raised by these data. The most obvious one is that the Black children are really being inundated disproportionately with inducements to consume foods that are known to be to increase health risk, either in childhood or also later in life. And knowing that these foods are readily available and promoted, that the advertisements are tailored to have ethnic appeal and actually create norms about what kids should be eating, so that there's a wraparound environment that promotes the consumption of these foods to the excess compared to other children, to white children. So these marketing patterns are problematic for children and teens overall, but they're especially problematic for kids who are targeted with more of these ads, and it's of concern that the targeted ads seem to be going up within the context of the overall expenditures going down. We don't know what that means, but it can't be a good thing if it was already problematic and that this type of advertising is going up. The comments from the teens that the Red Center interviewed also created concern that even though the teens and children and teens might like the ads in a way, that it could be increasing to a sense of being exploited and feeling that they're being singled out for this type of advertising. So it's encouraging to see that this can be recognized and that the kids might want to push back, and I'll come back to this in a minute. So given these concerns and given that this pattern has been seen now in a second report and it's persisted over time, it's fair to ask if the positive recommendations will be enough. I think you can see in our recommendations, and you could hear in Jennifer's presentation, that we are, you could even say, bending over backwards to recognize that marketing itself is not bad and that it has benefits. Certainly the revenues that come into Black-oriented media would be positive. There are a lot of other positive things that some of the same companies are doing for Black communities in terms of sponsorships and scholarships and things of that nature. So looking at this, you have to say, well, yes, it's good that you're positive and that you're encouraging a different pattern of marketing and encouraging standards and pledges to meet these standards. But given that healthier foods are not advertised very much overall, do we really think that this will be enough to shift the pattern so that the targeted communities are seeing more ads for the healthy foods and fewer, relatively fewer, for the unhealthy foods? And so I think that we need to be very positive on our recommendations, but I also think that we need to think more broadly about what are the company's responsibilities. This gets into very complex issues of the marketplace and marketing ethics. When is it ethically problematic for a company to market in a certain way? These issues have not been resolved, but I did want to raise them for people to reflect on. What do we think is the company's responsibility? Are we only going to argue that they're missing opportunities to market healthier foods, or are we going to argue that they have a responsibility to look at the broader effects of their marketing patterns? I think that we have a good argument when it comes to children and teens that the companies do have a broader responsibility, and they have acknowledged it to the extent that they've made pledges to market in a different way. But the tricky issue is, can we single out children in a particular ethnic group and say that companies have a responsibility to provide special protections within their marketing strategies, or at least not to exploit populations? And that this conversation needs to take place because it is very tricky technically, and it could have problematic consequences to say that children in certain groups need to be singled out for special protections, while on the other hand you could look at the data and say, well, they're being singled out, say, for special targeting of the unhealthy products. The consumer-focused approaches, and Amelie has already commented on these, I think are really critical. Consumers being teens, parents. Since I'm speaking from a Black health perspective, any stakeholders in the Black community. There have been some efforts to look at the best way to sensitize. We've done some work on how to sensitize consumers to the problematic aspects of marketing, and those approaches may have some promise. They haven't been really tested enough. And I think with teens, we have the example of the Truth Campaign and smoking and teens really being mobilized to try to position themselves differently in the marketplace and push back. But that's not going to be, it's not the same issue when it comes to food. So how do we take those comments from the focus groups, how do we take that and turn it into energy to push back and create a demand for healthier products and resist being positioned as a consumer who can be targeted with products and just continue to buy them and like to see themselves in ads and so forth. So my contribution to this webinar, I think, is just to cause some thinking, especially among public health, say educators, practitioners, who still are not heavily engaged in pushing back on marketing. You know, we have our own messages. We need to admit that these other messages are drowning out our messages and making it hard for people to take them up and adhere to them, and see if we could really include marketing issues in public health promotion in a more substantive way. So I'll stop there and turn it back over to you, Jennifer.
Thanks, Shriki. So I think we're just going to, Sally is going to finish up with some resources, and then we're going to open it up for questions.
Great. Thanks, everyone. So we have some resources that we've developed for advocates working on these issues, and you'll see them on your screen. We have infographics here for posting on social media. We also have taken the report and created short summaries, both looking at advertising targeted to Hispanic youth and advertising targeted to Black youth. So you'll find them on our website, and I'll share that website address with you in a second. And we have Spanish language versions of the summaries and all of our infographics as well. Jennifer, you can advance the slide. And then we've put together a short PowerPoint presentation that looks at specific targeted campaigns that companies in our analysis have conducted over the last few years. So you can go through, look at different brands and see how the campaigns have specifically targeted Black and Latino youth, which is really interesting. And throughout the years, the Red Center has always looked at naming names, so calling out companies that are doing the best in the way of marketing and companies that are doing the worst. So this will help you get a better idea of the targeted marketing and the types of products that are being marketed to teens. And you'll see again that they're primarily the unhealthy products and brands. Next slide. And we want to thank the co-authors of this report, Dr. Shriki Kumanika and Dr. Amelie Ramirez for joining us on today's presentation. You'll see the whole marketing, communications, advocacy team listed here on the slide from the Rudd Center, and our address, web address is in the bottom right-hand corner there. You can go to our website. You can find the report and all of these other materials. And feel free after the webinar to reach out to me or to any of the presenters if you need more information or have difficulty finding these resources.